the urgency behind Medicare. So if you are a new Medicare applicant, time is of the essence and you must act now, as time will slip away very quickly and then the penalties will start to accrue. Well, I want to share with you exactly what you need to know, the timelines in which you must take action, as well as I will share with you my own personal story where I didn't act fast enough and I actually accrued some massive penalties, which honestly I didn't even know about at the time, and I wish I would have seen a video just like this to help me out at the time, because now I have all those penalties and they are there forever, and they're pretty hefty penalties, honestly, okay? So anyway, you have a certain amount of time that I want to share with you here in this video because, again, it's a relatively large amount of time, but it also goes by very quickly, and it can be massively confusing transitioning into Medicare. There's a lot of moving parts. I think we all recognize that, right? Now, here's the thing. Enrolling in Medicare in and of itself is honestly not that big of a deal. It's honestly not that hard. You can go to the Social Security website or you can call Social Security. You can do it right there and you can enroll in benefits. However, the tricky part is making sure that you're doing it within the time allotment that you have. Now, first off, let me throw this out there super fast. You probably noticed right over here, this phone number. By the way, this is by far your best resource. I can confidently and authentically say that is by far your best resource right now with this transition into Medicare. Check this phone number out right here. Take a picture, take a screenshot, write it down, whatever you've got to do. This will connect you with a team of trusted advisors, the partners here on the channel, Chapter Medicare, where they have access to over 20,000 plans across the country, and they're helping seniors literally every single day navigating Medicare with the initial enrollment, Medicare supplements, Medigap plans, Part D plans, Medicare Advantage, whatever fits you and your personal needs. And again, for whatever you need, they have access to over 20,000 plans, and everybody's needs are very different, but they're working diligently to find you the best plan at the best price with the best coverages for you and your personal needs. More on that in just a minute, but seriously, please write that phone number down, give them a call. It is totally free, by the way. And again, I'm very confident that will be your best headache-saving, frustration-reducing, confusion-reducing resource that you will have during this transition, okay? I'm very confident of that. Anyway, please write that phone number down, take a picture, take a screenshot, whatever you got to do. Okay, let me share with you just super fast here my experience with this. Now, many years ago, when Medicare was available to me, I didn't take it. Why? I was like, I don't need it. I'm healthy. I'm young. I'm good. I don't need Medicare right now. I don't want to pay the premium, right? So I waited a few years. I did not take Medicare when it was available to me, right? I waited a few years, and then I got a little older, and I was like, should probably take Medicare. So I did. Guess what? I incurred the penalty. It's a permanent penalty, 10% per 12 months that you delay taking Medicare, a 10% penalty to the premium. I delayed for at least 3 years. I think it was 3 years that I delayed. Anyway, first off, you might be thinking, dude, you're full of it. You're not 65. You're right. I'm not 65. But I got Medicare because I'm blind and SSDI benefits, so Medicare was available to me, okay? That's one of the things about getting SSDI benefits. After 2 years, you become eligible for Medicare, and that was my situation. So you're right. I'm not 65, but I did enroll in Medicare because SSDI benefits, and I'm blind dude, right? Disability. Anyway, that's how Medicare became eligible for me, and that was my experience. So anyway, yep, I locked in a pretty significant 30% penalty on the Medicare premium. Ouch. Yeah, tell me about it. Exactly. And that is forever, by the way. Okay? Anyway, let me share with you the details behind this. Again, I'm not trying to scare anybody here. I'm just saying, please learn from my mistake. I had no idea. Nobody told me, and I'm not pointing the finger at anybody else. It's totally 100% on me. But I had no idea. I literally had no idea. This was many years ago, by the way. Okay, anyway, just I try not to think about it too much because it still bothers me how much more that premium is, and it goes up a lot. Okay, anyway, that's the situation. Okay, now here's the thing. If you are one of the roughly 11 to 12,000 people turning 65 every single day, or the millions of people that are retiring every single year, please pay attention to this. Super important information right here, okay? If you're turning 65 at all right now this year or anytime, it doesn't matter when it is, if you're turning 65, you have a 7-month enrollment window, okay? You probably already know this, but let me point it out really quickly again, because it's always good to be reminded of this, because if you miss the window, that's when the penalties start to accrue. Okay, anyway, you have a 7-month window in which you can apply for Medicare. It's the 3 months leading up to the month in which you turn 65, the month of your 65th birthday, as well as the 3 months after your 65th birthday. It's a 7-month window, okay? Again, 3 months before the month of your birthday, the month of your 65th birthday, and then 3 months after your 65th birthday. If you delay to enroll in Medicare beyond that 7-month window of time, that's when you're going to start to see those penalties starting to accrue, okay? So please, just take action. Now, here's the thing as well. You might be thinking, nah, I don't need this information. I'm not turning 65 until December, September, January of next year, whatever it happens to be, right? That's okay. You might be thinking, I'll come back to this now. Here's what I'm going to say is this. Call that phone number. Seriously, write the phone number down, take a picture, take a screenshot, write that phone number down. Again, it'll be your best resource. Reach out to them. Here's the thing. The best thing to do, reach out to them and just establish that communication. And then when you get within the 7-month window, okay, when you're within there, then you can start locking up those plans and getting you the best coverages, but you can start doing research and now, okay? But my point is, just get ready. I mean, seriously, 7 months feels like, 7 months is like so long. I don't really need to do anything now. It feels that way. 7 months zips right on by. Think how fast a year goes, right? We're living our lives and it's like, how did it get to be 2025 already, right? Do you remember good old Y2K? Feels like it was just a couple years ago. No, 25 years ago. Yeah, exactly. It goes super fast, right? That's my point, is it's kind of scary. But anyway, so take note of that, okay? Now, another question that I've received multiple times is, hey, when should I reach out to the advisors? Again, when should I call this phone number to establish some help for my Medicare? Now. Seriously, now, just call them, establish that communication. They will gather some data like, hey, when's your birthday? They'll figure out when you can start enrolling, things like that. And again, you can start shopping those plans and again, finding the best plans in your local area for the best price, best coverages, best plans, whatever it happens to be. Again, so you can see the doctors you want to see, the providers you want to see, the networks you want to be within, the offices or the clinics you want to go to, the prescription needs if you have any at all. They'll have access to over 20,000 plans, and they can help you navigate all those, which, by the way, there's a ton of plans in your local area. I guarantee you won't even know about all of them because there's so many different options, and they can help you navigate all that and find you the best options. Please let them do the grunt work for you. Don't try to hack it out yourself. It's a huge headache if you try to do it yourself. Okay, anyway, so that's people turning 65. Let's talk about retirement now, okay? Let's just say that you are retiring. So maybe you're, 65, 66, 67, 70, whatever it is, and you're retiring, okay? Same type of situation here, whereas you also have an enrollment period of time. But it's different for those people that are retiring, okay? Now, when I say retiring, provided you are leading up to your 65th birthday or 65 or after for retirement. If you're retiring at, say, 54 or 55, well, then this unfortunately doesn't really apply to you. But fortunately, congratulations, you're retiring very early and very young if that's the case, and that's very, very exciting. But my point is, assuming that you are retiring maybe at the age of like 64, 65, or after, then this is very, very, very relevant information. But the point being is that you probably have healthcare through your employer, right? You're going to lose that. Upon retirement, you're going to lose that. Again, not trying to scare anybody, just sharing you the reality of the situation. Anyway, you also have an enrollment time frame. It's an 8-month special enrollment period, okay? So if you lose coverages, then you would be, right, with your employer plan, you'd be losing coverages. You have an 8-month special enrollment period, otherwise known as the SEP, Special Enrollment Period, where you can go in and out of plans, you can enroll in Medicare, you can shop supplement plans, Medigap plans, Part D plans, Advantage plans, whatever it happens to be, and again, whatever the advisors with this phone number will find for you. And again, they'll only find you the best plans. They're not going to recommend some random-ass plan that's not going to serve you, right? They're going to recommend the best plan for you and your personal situation, okay? Anyway, Write the phone number down. Again, they'll be your best resource. Okay, my point being here is that you have the 8-month window, special enrollment period of time that you have, okay, to basically get into Medicare. And again, if you miss that window, well, then it's going to be kind of a bad situation because that's when the penalties accrue yet again, okay? Anyway, this is kind of what you need to know. Now, obviously, throughout the course of the year, there's other periods of time that do open up for people to come in and out of plans, but just for those people turning 65, you have the 7-month initial enrollment period, IEP, or as somebody that's retiring, you have the 8-month special enrollment period, otherwise known as SEP. Otherwise, between October 15th and December 7th of every year is the AEP, annual enrollment period. Otherwise, between January 1st and March 31st every single year is the open enrollment period, or OEP, and that is just for Medicare Advantage beneficiaries, okay? Either way, a lot of different timelines you need to know here. All my point is that 7-month and the 8-month window for the initial enrollment period for somebody turning 65, or the 8-month special enrollment period for somebody that's retiring, goes fast. I know it feels like it's such a long time, 7 and 8 months. Wow, it's so long. I got all the time in the world. It feels that way, but it also takes time. Please take into consideration the amount of time that it takes to look through the plans, to make the decision on the plans, to gather all the data that you need to make the most educated and best decision for you and your personal situation. Take this also into consideration. Our medical needs change all the time. Look at your current scenario and think, hey, medically, what do I need right now, right? That's why it's such a really good idea to review your history and what you need every single year, because here's the thing. Plans change, networks change, doctors change, co-pays change, premiums change, all of it changes, right? So you got to review this every single year. The worst thing that could happen is that you just let your plan ride, or you don't, review your plan, and then all of a sudden the next year rolls around, you're locked in, and all of a sudden, whoops, I'm on the wrong plan. They don't cover what I need this year because my medical needs have changed, or the doctor that I was seeing is no longer in network, my co-pays went up a ton, my premium got jacked up, all kinds of things like this. That's why it's so important to review. Anyway, again, your best resource right there. Phone number, please. Write it down, take a picture, take a screenshot. And the reason I say this, please don't try to hack this out yourself. I did it with my parents when they were turning 65. We hacked it out ourselves. Not a good idea. What a total waste of time and a ton of frustration and confusion because we didn't know and we were just hacking it out ourselves. Same situation when I enrolled in Medicare many years ago. I had no idea what I was doing. No clue what I was doing, right? I actually had a neighbor lady that worked kind of in the insurance field, and I was like, hey, can you come over and help me? She literally came over. I was living with my parents at the time. She came over and she's like, I don't know what you need, but here's probably a decent plan for you, right? She was just helping, and I thought, wow, she's like so good. She's helping me so much. My point is, these advisors right here, same situation, just like the neighbor lady, which, by the way, I don't know if she's going to be watching this video, but hey, you know who you are. Thank you so much for your help. Really appreciate it. Highly doubt she's going to watch this video. It was many years ago. But my point is, these advisors right here will do the same thing as that neighbor lady did for me. Help guide you through the situation and find a plan for you, the best plan, and extremely helpful, extremely knowledgeable, very professional, and really, really good resource. Okay, anyway, let me ask you a favor. Who do you know that is also in this situation? Please think of a few people, 1, 2, 3 people that you know, friends, family members, neighbors, acquaintances, siblings, coworkers, parents, anybody like this that's in this situation where they're also turning 65, retiring, eligible for Medicare. Please share this video with them and share this phone number, again, for the trusted advisors with them as well. They'll be so incredibly grateful for that information and so incredibly appreciative to you and that information. Anyway, go ahead and share that, and yeah, you'll be the hero when they call and they get all that assistance and all the help getting through this whole situation. You get to be the hero that gave all the information to them. Anyway, hope this helps you. Otherwise, if you're new here, if you have not done so yet, please subscribe. 100% free to do so. Big subscribe button down below the video. Check out the other 5,000 plus videos here on the channel in the video library. The popular videos I've hand selected for you down below in the description or popping up on your screen here in just a second. You'll see some videos there. Check those out. Otherwise, until next time, have a nice day. Thanks so much for joining me. Really appreciate it. And I hope to see you again soon in the next video.